Assalamu alaikum and welcome back. You are listening to the Mari Mukunda Show on Salam Media. It is 12:32 on this Wednesday, the 23rd of September 2020. So yesterday we spoke about female infertility with OBGYN Dr. Tomokaya, and now we are going to be tackling male infertility with urologist Dr. Salim Choonara, who is on the other side. Assalamu alaikum wa rahmatullahi wa barakatuh, Dr. Salim, and shukran for joining me once again.
Walaikum salam wa rahmatullah, Maryam. Thank you so much for having me, and salams to your viewers and listeners as well.
All right, so Dr. Salim, first define what male infertility is.
Okay, so infertility, what it means is that the inability for a male to be in a situation where he's actually able to conceive a child with a female partner. Clearly, you mentioned about the female aspect to it. Obviously, this requires, male and a female following intercourse. You get the sperm being produced by the male and the egg by the female, and obviously the two have to meet to ensure that this fertilization that takes place. So, male infertility is everything that can be related to that process, from issues around getting an erection to the ejaculatory process and the whole mechanism of delivering sperm into the female. Are all the issues that can relate to male infertility.
And what causes it?
Okay, so as I said, if you think about it in terms of production, let's consider, because remember the central component from a male perspective is the sperm, and let's consider all the causes in a systematic way. If we think about it, we need to consider first of all where the sperm is produced. So that takes us down to the level of the testicle. So any abnormality that can affect the testicle potentially can affect the ability of the testicle to produce healthy, good, normal sperm. Okay, so that would be things like, for example, mumps, that can affect the testicle. It involve like trauma, injury to the testicle, and also we think about infections also that can cause some issues relating to delivery of sperm from the testicle. Then we think about all the issues related to the brain, because remember the testicle is under control from the brain. So there's certain hormones that come from the brain that tell the testicle, that inform the testicle, that stimulate the testicle to produce sperm, healthy sperm. So again, they can be a mechanism that can affect that. So for example, your hormonal manipulation, hormonal imbalances, genetic aspects that can also interfere with the production of hormones from the brain that lead to the testicle. And then if we think about it, if it's produced in a normal way, how does it get out from the testicle? So anything along that pathway can also affect that. So for example, sorry, Amore, we think about issues relating to, the ducts that leave the testicle. Once the sperm is produced in the testicle, it's got to move out of the testicle and get into a certain tube, the epididymis, from there into the spermatic cord, and from there eventually it gets delivered via ejaculation through the penis itself. So that area from the testicle to the penis can be anything with obstruction of the tubes. Again, it can be from trauma. It can also be related to previous infections, certain genetic abnormalities that can do that, previous operations, that, especially in men that have a urethral surgery or prosthetic surgery, that can interfere with the actual delivery of the sperm. So there's multiple levels at which we look at it, and then the important thing about investigating male fertility is that one is to follow a systematic approach, so that you cover all these areas from production right down to delivery, looking for any abnormalities along that pathway.
So, doctor, does age, weight, and health have anything to do with all of the causes that you've just mentioned?
Yeah, certainly it can. Age is definitely a factor. Obviously, in older men, although men remain fertile, for probably as long as they are alive and they can produce healthy sperm. But there are aspects related to age that can affect that. As I mentioned to you, things like infections around the prostate, enlargement of the prostate. Often men, as they get older, they're on medication for the prostate, which itself interferes with the ejaculatory process. Those men that have surgery to the prostate, for example, that can also interfere with their ability to have kids. In the younger individuals, we think more on the line of hormonal imbalances, hormone deficiencies, particularly from the brain, the pituitary gland, which produces hormones that help to regulate production of sperm from the testicle. and also testicular issues itself. Things like trauma, maybe sports injuries to the testicle, things like testicular torsion. Where the testicle could have been removed, undescended testicles, where the testicle doesn't descend completely to its normal position, and it affects the function of the testicle. Infections also play a role there as well. So the thing is, yeah, it's varying. I mean, it certainly age can be affected depending on what the circumstances at that particular time or what cause we're entertaining at the time. But yeah, it can affect any age group. I mean, we have often young couples that have problems with fertility. And also you have sometimes individuals that have had a child and then maybe after 10, 15 years or 10 years, they want to have another child. And then they may be a bit older now and then they find they're having issues. So the age is a factor. And like I said, it's a systematic approach that gets one to the problem eventually.
Okay, so how common is it?
Okay, so I would say probably, I would like probably about maybe in the region of about 38, 40%, of cases that we see with male with infertility. Remember, when we look at the causes, again, because remember, infertility relates to both male and female. So
Yes.
often there's about a 30%, 35%. We often talk about a third. So a third of cases involve the male, a third of cases involve the female, and then there's the third that involves both the partners. So that's sort of a broad way of maybe thinking about the potential or the incidences, the likely incidence of infertility.
Doctor, I know we spoke about age, weight, health, but what about medications? Are there certain medications that can also contribute to infertility?
Certainly. So, specific to our field, it would be individuals and sometimes even younger individuals that are on medication to help to aid their flow. So they may have issues urinating, and they may have to be on something called Flomax, Uromax, Temzil. So those are sort of the common, names that people would be aware of. And sometimes they even use this type of medication for blood pressure. So this type of treatment, in particular, can cause what they call retrograde ejaculation, meaning if you have intercourse, you have an orgasm like normal, you feel like you are ejaculating. The male will feel like he's ejaculating, but you will not see any ejaculate coming out. Because what happens is it goes back into the bladder, retrograde, meaning it goes behind, goes back into the bladder, doesn't come forward. The medication does that. It can be a result of the treatment. There's certainly other antihypertensives that can also do that, certain blood pressure tablets that can do that. And also, we see those also in individuals that are on treatment for depression, those that are involved in treatment with mania, manic episodes, and also other medication tends to relax the smooth muscle of the body. Because remember, for ejaculation to take place, it's a muscular contraction. It's a tube that has a muscle around it, and for the sperm to be expelled, that tube has got to contract to allow the sperm to be propelled forward. So, for example, you look at and sometimes we see this obviously in patients that are quadriplegic, paraplegic, where their nerve supply is deficient, and you find they can't. There's no ejaculation at all. So yes, there are medications that can do that, and often like I said, we'll go through a list and see, if a patient is at risk for any issues with related to ejaculation because of their medication. But yeah, the answer is yes, definitely.
All right. And what treatments are involved in treating male infertility?
Okay. So, I spent a bit of time earlier on sort of detailing you or giving you a bit of an overview of the causes of infertility. And the reason why that is such an important process, because if you spend a bit of time with a good history and examination and spending time to try and isolate at what level the potential problem is, therein lies your treatment. So once you know the level at which you are dealing with, it's very easy to obviously formulate the type of treatment for this individual. So possibilities would be like, let's go from the top down. So let's consider from the brain, for example. If there's an issue with hormones being produced by the brain, then one could substitute those hormones. If there's a tumor in the pituitary gland and one would investigate it and manage that situation, that may help to overcome the problem of the testicle. If it's at the level of the testicle, if the testicular cells are not producing sufficient sperm, we can use certain medication to promote the production of sperm from the testicle. Okay. If the issue is a delivery from the testicle coming out, if there's a tube blockage somewhere, we can just obstruct the tube. If there's a problem with obstruction of the urethra, we can deal with that. So again, it depends on which level we're dealing with will ultimately determine the type of treatment we're going to give this patient. All right. So it will be anything from medication to surgical procedures. What we as urologists commonly see as a cause for infertility is something called a varicocele. So varicocele in our field is regarded as the probably most common surgically correctable cause for infertility. And just in a very brief summary, a varicocele is like these dilated veins around the testicle, which tend to interfere with the production of sperm from the testicle. So you need a surgical procedure to try to tie off those veins so that there's less pressure and less blood flow or less high pressure blood flow around the testicle. Okay. Now it's interesting situation here, for maybe for your viewers and your listeners to understand is that the testicle is a very unique organ because remember it's got two functions. One cell line which produces testosterone, which is also required for male performance, for male development, for male sexual performance, etc. And the other cell line produces the sperm. So in one organ, you've got two different cell lines. Of those cell lines, we've noticed that the cell lines that produce sperm are more sensitive. And we commonly see this in children that they have undescended testicles, where they're born and the testicles higher than it normally should be. It's not in the scrotal area. You find that in those cases, the cell line that sort of is damaged or that doesn't function first is the ones that produce the sperm. So often we find there can be an infertility issue in those individuals that have undescended testicles. So again, the level of the involvement determines the treatment.
Mm-hmm. And are these treatments effective?
Yeah. So regrettably, it's not 100%. If we go back, if we start thinking about varicocele, for example, like I mentioned to you, it's the most common surgically correctable cause for infertility. We also know that some men have varicocele and they don't have any issue with infertility. But if we're dealing with a male that has an infertility issue and we find a varicocele, we want to correct that. Does it mean that if we correct that varicocele, then 100% of cases will correct? The answer is no. The success rates are probably in the order of maybe 60, 70% will likely have some improvement following that kind of surgery. With regard to medication to try and promote the production of sperm, we may see a higher rate, probably closer to 70, or I would say 70, 80%. And also the other hormonal and the other surgical methods to try to relieve obstruction will not work in 100% of cases. There are many microsurgical techniques that can be performed to relieve the obstruction from any tubes from the testicle to the penile area. But we're talking of tiny, small little tubes. You need a microscope and high magnification to actually operate on those kind of anatomical structures. So the successes are not that great. Once you get down to the intricate sort of mechanism that are controlling the delivery of sperm, you offer the patient the best chance they can give. Because remember, Miriam, that patients in this situation they tend to be desperate. They want to have a child, and even if there's a small percentage of success, we're happy to take them and we're happy to go with that. So I would say, look, it's not 100%, but there is a fair chance of success, with most treatment strategies. Interestingly enough as well, there are many fertility centers now. I've also been exploring this in some of my patients as well, is that we're using stem cell therapy. So in males where the cells are so deficient that they can't produce sperm at all, we're starting to use stem cells, in other words, the patient's own cells, injecting it back into the testicle to try and promote the production of sperm again from those cells, sort of reignite and reinvigorate those cells to start producing the sperm again. So there are interesting techniques available, and we will do our best in that field.
All right. It sounds like there's a lot that needs to be done, but is it affordable? Is the treatment affordable and available at public healthcare facilities as well?
Yeah. So the first part of your question, is it affordable relative to an individual's means, I presume? But infertility treatment is expensive. Medical aids also tend not to cover, most of this type of treatment. If one is to go, for example, an assisted reproductive technique, let's say, for example, the male just cannot produce sperm that can come out the normal way. One is to go and extract the sperm from the testicle, and then in the lab, the sperm and the egg has got to be fertilized. So there's an assisted reproductive technique. That's expensive, and there's no guarantee for that. There's thousands and thousands of rands, not covered by medical aid at all. That's an expensive sort of approach. The other methods that I spoke to you about, for example, like the tablets or the hormonal manipulation, those are not that expensive. I mean, it's generally fits with most other type of treatment strategies. Prescribing something for an individual to take. Once you go to surgical techniques, it becomes a bit expensive because then one has to go to a theater, you require an anesthetist, a procedure, etc. Medical
Mm-hmm.
aids, they do tend to cover them with some motivation. They cover, like for example, a medical seal. I've had cases where if you motivate to them, they do cover the procedure. Some medical aids will say they don't cover the procedure. With regard to the public facilities, that's maybe a bit of a problem. To my knowledge, I haven't been in the public service now for some time, but
Mm-hmm.
to my knowledge, when I was there working at Johannesburg and Helen Joseph, we had a very limited service in terms of fertility. We actually would rely a lot on one of the centers in Pretoria. I think it was the Steve Pretoria Academic Hospital, which is a government hospital, but there was a
Yeah.
very very well run infertility center there by one of the professors. So we would often send our patients that require that kind of advanced therapy to them for further treatment. There's long waiting lists. Eventually, you do get there. So there is a service being provided, but they're overwhelmed by numbers as well. So one needs
Mm-hmm.
to be patient with that. But to my knowledge, the Pretoria Center is still working very, very efficiently. The Pretoria Academic Hospital.
Mm-hmm. And because of that, there is such a misconception that infertility is something that only people with money can afford to do and take care of, because I mean the treatment is quite expensive, and if you're poor and you're infertile, then it's probably, some people look at it as I don't know, God's punishment to them. But hopefully there will be other means to sort out this problem. Quickly, doctor, the tablets and other medications that you mentioned, are they available over the counter?
No. So one requires a prescription for that because we using we manipulating the hormones in an individual. One needs to look at other medications that they're taking as well. They must understand the potential side effects of the medication. So definitely not over the counter. You must see a specialist or professional that will have to then prescribe that. Just another point you made about the affordability.
Mm-hmm.
Regrettable, there's such a massive divide between the public service and the private facilities. And often it's sometimes it's a sad situation to sometimes find individuals that don't have a medical aid or they can't access the private facility, but then eventually out of frustration they come to a private facility.
Mm-hmm.
And because they're desperate, what they will end up doing just to get money and pawn their homes and take loans, etc., does make one feel pretty bad. And we hope that with time, the public service also will catch up a bit. But just for information's sake, for your viewers and your listeners, to my knowledge, there's a very good center in Pretoria. And often if I have patients that cannot afford it, that require to access the state facility, we still make use of that referral point. We're still running quite a good service there.
All right. Well, shukran so much for your time and the knowledge and insight to Dr. Chunara. And hopefully, our listeners and our viewers will make use of the information, especially those who are looking for infertility treatments at public healthcare facilities. Shukran. Assalamu alaikum.
Jazakallah. Assalamu alaikum. Thank you so much.
That was Dr. Salim. Treatment. Like for example, the tablets, the medication are not available over the counter, so you will need a prescription. You will need to go and see a specialist for that. In fact, any such problem like this, you will have to go and see a specialist anyway. When you go to a doctor, when you go and see a doctor, they are special, and they will direct you to somebody even special if they find something that they cannot diagnose. Anyways, please leave your comments, questions, or queries or suggestions in the comment section, and we'll send them to Dr. Chunara to have a look at and reply to them if needs be. So do stay with us. We'll be right back.
Discover the Africa of your dreams and surround yourself with her spectacular